Are there different methods of performing a targeted biopsy, and how do those different methods work? Do you have a preference of which one's better than another?
So there are a lot of different ways to do targeted biopsies. Perhaps the most accurate and also possibly the most uncomfortable is doing an in-bore MRI-directed biopsy. I say the most accurate because in the MRI itself, they can see the needle going into the suspicious spot and confirm that the needle is properly located, so that when you get the biopsy results back, you know that they sampled the correct location. A little more convenient is something called a fusion biopsy, where they take the MRI images and load them into a computer, so when someone does an ultrasound of the prostate, they know where to stick the needle. The ultrasound doesn't see anything, but it is able to use coordinates and poke the needle where the spot is thought to be. A third methodology, which is probably available to any urologist, is to simply look at the description on the MRI, which says that the suspicious spot is in the upper left-hand corner, and then the doctor goes in and jabs a bunch of needles into the upper left-hand corner. And then a fourth methodology, one that we use in our office, is to use a high-resolution color Doppler ultrasound to look in the upper left-hand corner and see if we see a spot that can be targeted. You don't always see the same spot that MRIs are talking about, but often you can. I'd say 2/3 to 3/4 of the time when the MRI says there's a spot in the upper left-hand corner of the prostate, using the vernacular, the color Doppler can see it, and then it can be targeted directly, which is quite easy to do in the office in a 5-minute procedure. Who needs which type of biopsy? I'd say that the people that have large, simple-to-access lesions can do color Doppler-directed biopsies. People that have small anterior lesions, what are called transition zone lesions, often won't be visible on color Doppler. And those people we typically will refer for a in-bore biopsy to make sure that the needle's really going in the right spot.
So you mentioned that the in-bore biopsy is uncomfortable. Can you explain why?
Well, it can take a whole morning to do these biopsies. The patients are put in the MRI on their tummy, and a robotic device sits between their legs, and the needle sticks into their behind, and it's just very time-consuming. There's a lot of preparation, but ultimately, if someone wants to be 100% sure that the biopsy got into the right location, the in-bore biopsy is the most accurate.
Now, as far as what's widely available out of those 4 methods, which one would you say is probably the most popular here in the U.S.?
I'd say that the fusion biopsy has picked up the most momentum. That's where they take the image from the MRI, load it into the ultrasound, because it can be done in the urologist's office.
Hey everyone, it's me, Alex, and our mascot Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high-fives me, high-five, high-five. Can you high-five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks that's awesome. Also, don't forget to visit our website, pcri.org.